psychosocial factors can also interact with different biomarkers to affect the functioning of our immune system. Experience of psychosocial stresses can affect our endocrine system, and this can affect the functioning of our immune system. And this works through the catecholamines, which is a form of adrenalines that bind receptors on white blood cells. And catecholamines is also responsible for regulating immune functioning. Stress can affect our abilities to fight infection, and this in turn affects our health conditions. This determines whether we are going to get certain disease, illnesses, or experience other conditions like cold, flu, wound healing, inflammation, vaccine immunity, and so on. Stress affects our ability to fight infection. Sometimes it works through our white blood cells. Other times, it works through endocrine and immune dysregulation. Stress can lead to both high and low white blood cell counts. In other words, stress can increase and decrease our white blood cell counts, and this can lead to different health implications. An experience of depression can affect the functioning of our HPA system and inflammatory responses. This in turn affects our immune functioning. It affects our metabolism, cardiovascular, and homeostasis systems. Exposure to chronic stresses can affect our cortisol level, and this in turn can affect our cholesterol and glucose level, and this can also accelerate the onset of atherosclerosis. This in turn can increase our risk of depression or cardiovascular disease. And sometimes exposure to chronic stress conditions vary across racial groups. Exposure to chronic stress or repeated stress conditions also vary according to educational and income groups. Exposure to chronic stress can also vary across gender or age groups. So this is another manifestation of how environmental factors can interact with different biomarkers to influence our health outcomes. Socioeconomic characteristics or statuses can affect our vasculature systems and metabolism systems, and this in turn can affect health outcomes. And socioeconomic statuses can also affect the functioning of IL-6, and this in turn affects our immune system and homeostasis processes and determines disease outcome. So this is another example of how environment interacts with different biomarkers to determine the onset of disease or various health outcomes. Living in low support environments, whether it's family environments or neighborhood environments, and living in harmful environments, high pollution, bad air quality, bad water quality, high crime, high violence, can affect the level of psychosocial stress. But the effect of low support and harmful environments on psychosocial stress can be mediated by a person's level of self-efficacy, a person's perceptions of stress, and the person's personalities. If a person have high self-efficacy, low perceptions of stress, and maybe positive personality traits, then low social support and harmful environments may have a small effect on psychosocial stress. And low support or harmful environments affect the SIGA, a kind of antibody immunity, through psychosocial stress.